Hey friends, hello, how are you? Myself Dr. Ali Anwar Qureshi, and I welcome you in my YouTube channel Health Tips. Friends, today we are discussing a very important issue, a very important topic that is a health related condition in which I am today talking is kidney stone. Friends, kidney stone is a major problem in nowadays. Our society, our members in the society, nearly 60% of the pupils will have, you will see they are suffering from or they are complaining of the abdominal pain or the pain in the urinary system or the urinary incontinence or the urinary problem. It is due to 100% due to kidney stone, friends. I guarantee you, I assure you that in India, I think kidney stone is on the larger graph. What about kidney stone we are talking about? I will discuss in detail, friends, because this is a live chat. And if someone asks me any question, I will give the answer of that question also. I am Dr. Ali Anwar Qureshi from Latur, Maharashtra. And let's start today's topic, our today's topic, kidney stone. Friend, kidney is an organ which is related to the filtration of fluids of our body. Kidneys are two and they are situated in the abdomen, on the posterior wall of the abdomen. And you will know how kidneys are working. Kidneys are related to the filtrations of the water fluid, and that fluid comes out of the body in the form of urine through urinary bladder, ureter, urinary bladder, and urethra. Friends, I will discuss you in detail because as it is a live discussion, so I am going for a live chat also. If someone asks me questions, I will surely I will answer it without revealing the entity of that person. Friends, kidneys are two as I have explained it, and they are behind the liver on the right side and in the left side also. If someone thinks kidney is only one, that is wrong. Kidneys are two in our body. Again, I will tell you, kidney is a wedge-shaped organ, and it is situated on the posterior side. It continues through ureter on the both the sides, and both the ureter concludes in the one single urinary bladder, and which opens into the single urethra, which passes the urine in male and female as both same. Friends, nowadays, why kidney stones are the major problem? Kidney stones are the major problem because we are having improper diet and improper water. We are having a vegetables which can cause the kidney stone, and we are having a water that is causing the kidney stone, that is the water of boring which contains calcium oxalate. Friends, I will discuss you two topics. That is, there are 2 to 3 types of stones. One is radio opaque and one is not radio opaque. The stones which are produced due to the vegetables that are not radio opaque and which will not be seen on the X-ray also. There are the stone which are radio opaque, non-radio opaque, and some are the stones is made up of the cholesterol fat also. So I will discuss you in a topic that kidney stone. If the stone is in the kidney, it will not harm you or it will not obstruct anything, fluid or urine. So that's not a problem. If the stone is on the pelvis, it may cause problem. And the major problem in the kidney stones patient is, that is renal colic or colic pain, is when the stone is at the level of ureter. That may cause hydronephrosis, that is urovesical junction. And friends, if the size of the stone is large, then it may cause huge pain. And whenever your stone moves the positions, that may also cause the pain. The kidney stone may be on the right side or maybe on left side or bilateral. So friends, you need to know that today's topic is kidney stones Ayurvedic treatment and allopathic as well. In allopathic, the conservative treatment is not much more. They gives, or the doctor's advice is the hydrotherapy, where they use injection Lasix to flush out the stone from the urinary system. And if the stone is big, they go directly to the surgery. Nowadays, advanced surgeries are also available, which you may not know, or you may know that laparoscopic surgeries are nowadays available, and there is no need to open do the surgery. The second thing, most important thing is in the conservative treatment, only the hydrotherapy is one therapy. That's all. But in Ayurveda, a kidney stone has a proper and good, very good treatment. Whatever your stone size is below 10 mm, that will get broken, friends. Today, friends, I will show you. I am showing you one tablet, that is the Neeri tablet, which is from the Amil company, and it contains Pashanbed, Gokshur, Apamarg, Shwet Parpati, and many more contents, which breaks the stones and crushes and flushes from the urinary system. Same type of tablet as such to Neeri is the stone wheel from the Phytopharma. Same tablet is Cystone from Himalaya. You can use any tablet, but according to me, this Neeri tablet is a phenomenal, friends, because I also use this because I am also having right-sided renal colic, and it sometimes alleviates the pain. But for your kind information, I doesn't take a single injections also for this pain, but I just follow tablet Neeri, number 1. Number 2, tablet Chandra Prabhavati for BD 2 times. Number 3, tablet Gukshuradi Gugud for BD 2 times. And last, syrup Varunadi Kala for 2 times, 1 teaspoon for 2 times. If you follow these 4 treatment options, your stone will be flush, 100% guaranteed. It's the formula from me, Dr. Ali Anwar Qureshi. It's a phenomenal formula, friend. I flushes my own stone and lots of patient stone also. At last, I want to ask you one favor. If you doesn't subscribe to this channel, Health Tips, be subscribed to my channel. If you are having a problem with English, if you doesn't understand English, if you understand Hindi, you can go to my Hindi channel, Health Consultant. I will give a link in this descriptions video, where I provide total health update knowledge in Hindi as same to health tips in English. So friend, what I am saying is, if you are having any problem of kidney stone or pain in abdomen, you just go to sonography, that is USG abdomen. USG abdomen is done. It will show you the size of stone, and the doctor will give you the injection and tablets, and the size of the stone is shown in the USG abdomen. That is the test which is most required in pain in abdomen. And if the stone is on the right side, you have to correlate it, or you have to differentiate it with appendix also. On the left side, it is easily diagnosable, but on the right side, it should be differentially diagnosed with appendix also, friends. And if you are having a pain in the right side, you have to go to sonography, or left side, go to sonography. The size of the stone might be confirmed with the sonography. And if the size is below 10 mm, you can go with the Ayurvedic treatment, Neeri, Chandra Prabhavati, Varunadi Kada, Gokshuradi Kukul. That's all for 2 months, because all the kidney will be cleared. If you are having a stone bigger than 13 or 14 or 15 mm, then in that condition, if that is causing the more problem to your system, that is hydronephrosis is causing by that stone at the urovesical junction, that might cause the increase in serum creat, and that might cause the kidney damages also. So in that condition, you will have to go to urosurgeon, and whatever he says or she says, you will have to follow that step, friends, immediately. You see, friends, what I am recommending about the treatment whether it is Ayurvedic or allopathic, if the condition is acute, then you have to follow allopathic treatment only. And if the condition is chronic or it is simple, then you can go with Ayurvedic treatment. Once your pain is subside, when the stone is below 10 mm, then you can go to Ayurvedic treatment. For sure, definitely, 100% guaranteed, your stone will be dissolved, broken and flushes out. That is Neeri, Varunadi Kala and Chandra Prabhavati and Neeri, Varunadi Kala, Chandra Prabhavati, gukshuradi one tablet. You follow it, you keep it in mind. Whenever you found a kidney problem with kidney stone, just follow these steps. And what you have to avoid in fruits or diet or vegetables, you have to avoid palak in the vegetables, and in water you have to avoid the water of boring which contains the calcium oxalate in the more forms. You just have to take the water of our drainage system, that's all. And you will have to increase your intake of water, daily intake of water. If you are drinking low minimum amount of water, that can also cause kidney stone. So you have to drink maximum water to resolve your kidney stone. If you are drinking maximum water, friends, your kidney will be in a good condition also. Another thing what I am discussing is you will have to follow the tips from the doctors also. The Ayurveda treatment is the best treatment for kidney stone and gallbladder stone also. Sometimes you may have the stone in both the kidneys, so you have to follow that treatment also for 2 to 3 months, so your stone will be flush out. So friends, this is the detailed information about the kidney stone. And sometimes there might be a stone at the urethra also, so that causes the pain at the upper side of the penis also. So that is the severe condition which some of the patient felt in the kidney stones. The pain during the kidney stone is basically on the midnight, friends. So Ayurvedic treatment I have discussed to you. Also conservative treatment in allopathy and surgical treatment is I discussed it to you. There are lots of technique which remove the stones. Basket techniques are available. Laparoscopy is available for kidney stone as well. Friends, if you are having a larger size of kidney stone, then you will have to go to the neurosurgeon for his or her opinion. So friends, I think you got understand what I am telling you, what I am saying you about the kidney stone. Kidney stone is a phenomenal disease, phenomenal condition in which the patient is suffering from lot of problems, friends. And the most important problem is urine incontinence. If you are not having urine properly, you should go to diagnosis for the sonography, and you can be diagnosed as a kidney stone. In blood test, we do serum creatinine. So friends, if you not still subscribed to this channel, subscribe it and you share it to the maximum. I'm your friend Dr. Ali Anwar Qureshi, signing off from my YouTube channel Health Tips. Thank you very much.